Great transition, Paulie. We bring on Dr. Kyle Plante, our weekly SOS house call. Dr. Kyle Plante is a family physician specializing in primary care sports medicine, including the management of sports-related concussions. Doctor, always great to chat with you. How are you today?
Hey, I'm good. How are you guys?
We're doing well. We're doing well. So the topic today is the aging athlete or the master athlete as we move on in years. And, this is something that Paulie and I can both relate to. Do the recommendations change for physical activity as you age? I would assume they do, right?
I've always loved the term master athlete until I realized that they classified it as age 35 and up.
Right.
And then I like that term a little more.
Yeah, exactly.
But yeah, so the recommendations, honestly, for 18 and up, pretty much kind of stay the same. They do start to get a little bit more tailored towards an individual when you start to factor in the presence of certain chronic conditions. So when people have arthritis or a joint replacement or different types of heart disease, lung disease, things like COPD, some of those things will start to play a role in what we might recommend you do. But in general, all healthy adults and masters should participate in like a moderate intensity exercise, something like tennis doubles, walking on a treadmill around like a 2.5 to 3.5 brisk walk for 150 minutes a week, or do a vigorous intensity activity for 75 minutes a week, and that would be something like running a 12-minute mile or better, jumping rope, do some calisthenics, that kind of thing, along with doing some muscle strengthening at least 2 days a week. So that's kind of the blanket recommendation, and then as you start to get into some of those other chronic conditions, you start to kind of tailor things towards the patient.
Paulie and I, Paulie's early 50s, I'm late 40s. We find ourselves coming in here and we'll be like, oh, such and such hurts today, and I don't even know why. I don't know what I don't even know what I did. Why is it that when we're 18 to 29 or we can run all day, we can work out, we're fine the next day. Why do we feel more sore, as we age, even if we're not doing the same strenuous activity?
Yeah, that's a really, really common question that I get in my clinic, that patients come in and just say, they think something's wrong. And they're like, I can't rebound like I used to. I can't, I'm sore for days. And, what's wrong with me? And I'm like, nothing. Most times, as you age, your body undergoes both, structural and functional changes. And so people say they feel like their endurance has decreased. And I'm like, yeah, that's correct. So to put it kind of simply, your muscles, you need oxygen to perform, right? And oxygen gets to your muscles through your blood. And so as you age, your lungs' ability to expand and take in as much oxygen as you used to decreases. And so does the rate at which your lungs will actually transfer that oxygen into your blood. And so, that combined with, your max heart rate goes down, your cardiac output, which is really how much blood that comes out of your heart per beat, also goes down. So your cardiovascular and your respiratory system, in fact, have to work a little harder to do the same kind of thing. And that's a normal process of aging. And then, when you think about it from a musculoskeletal standpoint, we have a natural increase in tendon and soft tissue stiffness. So you have decreased flexibility. You get a decrease in the amount, in the size of your muscle cells and their physical performance. So that leads to, decreases in speed and power and strength. And all of this plays a role. Your recovery is going to take a little bit longer than it did before to get back what you used to have. So, all of these things and a whole myriad of other kind of metabolic changes happen, but these are all normal changes to expect.
And along those lines, we all know exercise is important at any age. Is it more important when you get to Paulie and I, our age? Is it more important as we get, 50 and beyond to make sure that we stay active because, right? It has health benefits that could affect other parts of our health if we're not staying active, correct?
Of course, yeah. I think you get a little more bang for your buck as you get older. I think you do tend to get more important, the effects of it as you age. So, longevity of life, for example, endurance athletes or high aerobic kind of athletes, they average about 4 to 6 year advantage in life expectancy compared to, more sedentary, the couch potato. We know that this type of activity, it reduces the risk for infection, reduces the risk for cancer, reduces the risk for heart disease, the development of chronic diseases. And then if you already have some of these chronic diseases, it helps better control them. It can improve your mood, lessen the risk of depression, and then as you start to get kind of into your 7th and 8th decade of life, it can increase your strength, that reduces fall risk, and this increased activity can delay dependency, on family or caregivers by 10 to 20 years. And so overall, it's just, these are the big quality of life impacts that just doing a little bit of aerobic type activity can have on you in the long term.
Yeah, I see it with my grandma. She's 99 and she still does yoga to this day and tries to, keep moving and staying active. And it certainly, helped her, no doubt about that. I want to circle back to, you were talking about walking a little bit earlier. And I think sometimes people get intimidated by, I need to start an exercise regimen. They think they have to be like a marathon runner. But there are health benefits even from just going on like a walk around your neighborhood for 20 minutes, correct? I mean, what are some of the minimum health benefits that you can get from something like that?
Yeah, anything's better than nothing.
Yeah.
Staying active. And you can get this activity. It doesn't have to be dedicated time to go to the gym. It's going out and shoveling, going, in the winter months, being careful about it, but, doing that. It's things like, yard work around the house. Those require physical activity. And so, like I said, that minimum activity to achieve the health benefits is right around, the 150 minutes of moderate intensity aerobic activity a week, and spaced out, amongst the week, and then, or the 75 minutes of that vigorous intensity spaced out throughout the week. And then important to remember is that this also includes the strength training. So making sure you're moving those muscles. If you're going for a walk and you're doing, or even a run, you're exercising your lower extremity muscles, but there's still a lot of benefits from working out the other major muscle groups too. And so, and then, on top of that, increased activity for achieving even more health benefits. You see, if you go beyond those things, but you can make up, that 150 minutes, seems like a lot, but it's really, you put in 20 minutes, or 20 to 30 minutes, a few days a week, you can get there.
Yeah.
And so, it's not just, what the traditional view of exercise is, of going for a run or going to the gym. It can be made up of a lot of different things that increase your heart rate.
Yeah. All right. Last question for me. This is very informative stuff, but last question for me. We always hear, anytime you're going to start a diet or anytime you're going to start an exercise program, they always say consult with your doctor first. So what are some considerations that, if somebody, hasn't been exercising on a regular basis, what sort of considerations do they have to keep in mind before they, get started on something regular, a regular routine?
Yeah, you certainly want to make sure you're healthy enough to exercise. And is your heart healthy enough to tolerate exercise? And the exercise, your heart rate goes up and it stays up, for an extended period of time. And that's the good effect you're trying to get from the activity you're doing. And also your blood pressure goes up. So you want to have, reasonably well-controlled blood pressure before you start. If you have uncontrolled blood pressure before you start, you're already going to put a lot of strain on your heart. And so people who have a history of heart attacks, coronary artery disease, arrhythmias like AFib, lung conditions that cause you to be, short of breath at rest or even with minimal activity. Those are all kind of things that you want to make sure you kind of talk with your doctor about. There are things that you can do to get what's called an exercise prescription from them. The principle of it is tailored towards the patient and what their issue is, medical issues are, in a way that they can exercise and achieve this benefit, but in a safe way. And so, things, there's exercise stress tests that can determine exercise capacity if you get to it, and certain patients would certainly be recommended to do that. But if you begin and you start low and you kind of build your way up, that's probably the better way to do it. And certainly if you start having things like, chest pain, lightheadedness, dizziness, so you feel like, your heart's beating a little faster than it should be for the amount of activity you're doing, I would definitely make sure you speak with a medical provider.
All right. Really informative stuff, Doctor. Appreciate you coming on. Enjoy the rest of your week, and I'm sure we'll talk again soon on the weekly SOS House Call.
All right, guys. Thanks for having me.
All right, Dr. Kyle Plante. And with that, we'll hit a timeout. Phone line's back open if you want to check in, 315-437-7644. We have time for a call or two, and then Eric Devendorf at the top of the hour. And then after that, phone line's open the rest of the way. We're back after this on ESPN Radio.